Good morning, everyone, and welcome to the Department of Pediatrics. I just want to check that you can hear me.
Yeah, we can hear you clearly. We can see you. No
Right.
worries. Carry on.
Okay, so it gives me great pleasure to introduce the speaker for this morning, who is Associate Professor Dr. Subhashini Jayanath, who is a developmental pediatrician at UMMC. Prof. Subha completed her training, her fellowship in developmental pediatrics at the Royal Children's Hospital in Melbourne. And for the past decade or so, she has spent a lot of time and effort building up the developmental pediatrics service at UMMC from its simple beginnings to become a fully fledged child development center with the capacity for subspecialty training. So now I'll hand it over to Prof. Subha to tell you more about it.
Thank you, Professor, for the introduction. Good morning, everyone. Let me just see whether I can share my slides. Just a second. Thanks again, Prof. Marret, and good morning, everyone. It's actually it's a nice opportunity to be able to speak to all of you about developmental pediatrics, because I think it's something that I feel enthusiastic about, and I feel that it's nice to share that with everyone as well. Also, every now and then we get people asking us, like, what's developmental pediatrics? What do you do? What sorts of patients and cases do you see? So just to give you a bit of context, this is our clinic area, and then our clinics are located inside. So we have 4 clinic rooms within this child development center. And this is a picture of one of the rooms. And just to give you an idea again, these are some of the things that we have in the room. So we try to make it as interesting and fun as possible, so the kids like to come. And every time we have kids who are what we call gate crashers, who try to bang on the door to come in, that's always a nice thing to see, because we want them to be able to be happy to come to clinic and do the assessments that we do. So what is developmental pediatrics? Just to give you an idea of the scope of services, we see kids both in the outpatient as well as inpatient settings. Most of the cases we see are in the outpatients, and about 70 to 80% have autism. We also see a significant number of children with learning disorders, as well as those with global developmental delay, or what we call early developmental impairment, and the children with intellectual developmental disorder, and like a mixture of other cases as well. But the inpatient referrals now are actually increasing, and it's unfortunate that we have a bigger team, because now they see a lot of the inpatient cases, which we did not have the capacity to do before this. Okay. We also, before I go to that, we also see cases in the general pediatric clinics. And because we have quite a number of medical officers there, they're able to do the initial screening and referral, which we would not be able to do otherwise. And then when there are more complicated cases, they call someone from the team to come and assess. So I like to acknowledge at this point that we would not have been able to start up the Child Development Center with all the tools and the kits that we have if not for these people. So the MBBS class of 1981-86, and they donated a significant amount for us to be able to buy the tools to start up. And also Merck's and Riverheart gave us donations twice. And I need to basically I want to say thank you to Prof. Yazid, because he organized all of this. He was our head of department at that time. So thank you, and that's why we started our services. So this is just an example of some of the tools that we use. The WISC is an IQ assessment, and it looks very interesting. So, I mean, those of you who like playing with kids and like toys, this is a good field, because you get to stay a kid for as long as possible. Also, the Vineland looks at adaptive skills. So this is important if you want to assess someone's IQ, not just with numbers, but to see how they are in terms of day-to-day activities of daily living. And there are a few other things that we have as well. So this is the plaque that we put up in front. So before I went for training at the Child Development Center at UKM, I started off going for clinics with Prof. Marret, because Prof had started services there much earlier, and that was my initial exposure to developmental pediatrics and community pediatrics. And then I had to go to UKM because we didn't have training here. So I went there for a year, and I'm very grateful that I trained with Prof. Jayanath there. And then she was actually instrumental in organizing my further training. So because of what she did, she managed to open doors. I managed to do a dual fellowship at the Center of Community Child Health, as well as the Department of Developmental Medicine at the Royal Children's Hospital, Melbourne. And that paved the way for the subsequent trainees to go as well. So after coming back, I had to put in the planning to do training for fellows, because, you know, once you start, you need to make sure it's sustainable. Because people come and go, but the service should continue. So once that was approved, and I have to thank Prof. Nazira for allowing us to start this, because she was on the subspecialty approval committee, and with that committee, they approved training, which I drafted for UMMC, which is slightly different from the national training, but we're trying to basically make that all standardized. Then the Child Development Center was open with the donations that we received from the UM alumni as well as MERC. And then we started off with a part-time clinical fellow from University of Cyberjaya. So she came part-time and she went on to be one of the international fellows at CCCH in Melbourne. And then after that, I had 2 full-time developmental pediatrics clinical fellows who are here with us now. And they started off in 2020. And subsequent to that, we had a clinical attachment trainee from UITM, who's a pediatrician with a special interest in development. So she came to try to learn what she could in order to start up services at UITM. And then in 2023, we had one of our trainees from here went on to be an international fellow at CCCH. And then after that, we also were unfortunate because we had a clinical trainee who came in from family medicine from Public Health Hospital, who did her posting here as well. And following that, we had another in-house trainee who joined us. Okay. So after that, the services continued, they don't stop. But then we ended up being fortunate enough to have someone from child psychiatry who decided to do an attachment for a short while, and also provided some input from psychiatry here. During all of this, we actually had occupational therapists coming in from 2016 onwards, and I have to thank the OT staff for that, for coming in and adding value to our services. And now in January, we're scheduled to have a clinical fellow coming in from UKM. So we're sort of come full circle. Now they're coming in for training here as well, which is really nice. And along the way, we've had many international as well as local elective students. And the students are always welcome because they give us a lot of additional input. They are very enthusiastic. They've helped us out with research studies. And it's nice to have young people interested in this as well. Okay, so I just want to express my thanks to all the people who trained me at CCCH and who were my supervisors there, because it made a big difference having them. And then this is the current team. So I'd like to acknowledge the team here as well. Dr. Vivian, Dr. Muhammad Fawaz Husti, and Dr. Noramanda Zainal, who are our in-house either developmental pediatricians or clinical fellows here. So this little book, actually, I wrote it in 2019, and this is written for parents of children who have autistic features or are trying to find their way and they're looking for a diagnosis. And the reason I wrote it is because I found that there were many people looking for answers, and sometimes you can't really get reliable information online. Now, I think in light of recent events, even more so, but even then it was difficult. So this is something just so that parents know what to look for, and then where to look for help. And the other thing that came out of our unit was this. So this is a developmental pediatrics textbook, which we wrote. It was done with contribution of chapters from developmental pediatricians across the country. And Dr. Vivian and Dr. Fawaz also contributed chapters, as well as Dr. Rajini Sarvanandan, who's our visiting consultant, and Dr. Rajajanita as well, in addition to others myself. And the reason I wanted to do this was because we've always had medical students, medical officers who used to come and say, is there a reference textbook? Is there something that we can use to learn the milestones and to understand developmental pediatrics? And I felt it was very important to have a Malaysian book for Malaysians rather than, always looking at overseas texts as references. So I think this is something that concrete that we've done as a division and a unit, and it's nice to be able to have done that. This collaborative research network is something that we're part of, and this again was through Prof. Nazira as well as Prof. Yazid. They paved the way for us to have this connection, and Associate Professor Nur Hamizan Hamza from the Department of Rehabilitation Medicine is our head here for our UM unit. But It is part of a consortium where there are many universities in the region, and we've been working and doing projects as well as papers with them from 2020. So this is a nice long collaboration that's ongoing. And so this is now Associate Professor Dr. Nur Hamzah is our lead here at UM. Okay, so one of the things that we're quite happy about is the Asian Neurodevelopmental Disorders Registry. And we're part of the bigger team, which is based in Osaka. But for the UM team, this is AP Dr. Hamzah and AP Dr. Aida Jayanath from psychiatry. And we're doing a registry. So basically, this is like a database of the children that we've seen to try to analyze different aspects of their neurodevelopmental disorders and to see whether there are common themes between countries. Because regionally, we have a rich pool of data. And of course, numbers are larger when we go regional. So this is something that we're working on as well. So the team from Japan came in August 2022. This is when they visited the Department of Rehabilitation Medicine in OT. They came again in 2023, but this is a recent visit in 2024. And then it's Prof. Azana, who's our head of department, and Prof. Holmes, one of our collaborators as well. Okay, so I'm going to change gears a little bit and just talk about some of the studies that we did. So one is vitamin D status. And this was something which I presented at the INSA Institute. And the INSA Institute is it's a yearly thing that they have by the International Society for Autism Research. It's online, and it's a series of talks that they do to highlight research in different parts of the world. So this was presented in 2023. And I'd like to acknowledge my co-investigators, Professor Dr. Fong Chun Lee, as well as Dr. Rajni Sarvananthan, who worked on this project with me. And our source of funding is UMSC. So we managed to publish a paper on this, but I'm just going to give you a bit of the background. We wanted to look at prevalence and risk factors of vitamin D deficiency in our population, and also to look to see whether there was any association between autism severity and behavioral symptoms. And in addition to that, we looked at the severity with using a standardized rating scale, so the Childhood Autism Rating Scale. And for behavioral symptoms, we had to look at challenging behavior, for which we use the aberrant behavior checklist. And you know, I don't know whether you'd be surprised, but we found that there was a high prevalence of vitamin D deficiency, despite the fact that we have year-long sunshine. So it's numerous factors, but it's important because for the children whom we did discover vitamin D deficiency, we supplemented them for a period of time to ensure normalization of their results. And of course, you cannot be supplementing continuously. So what we planned to do after that was that we just gave them advice, like dietary advice, sun exposure advice, those sorts of things. And then hopefully those lifestyle changes could be instituted, because ideally you don't want to be supplementing people in perpetuity. But we did find there was a reduction in the severity of their CAS-2 scores between the time before as well as after treatment, only in the vitamin D deficient. So again, it's a very small group of patients. We don't want to draw too many conclusions from that, but it's just preliminary data which would warrant further assessment as well. But there was no reduction in challenging behavior. Okay, so this poster from that was presented at the University of Malaya Research Carnival, which was also done in 2023. And this is just a photo of the event. And there was a silent auction that was done at that time. And one of the patients from our clinic managed to contribute some of the paintings for this. So one of it shows some of the paintings. She was actually identified by one of our doctors. Dr. Fawaz managed to identify that she's talented and put in a name. And she actually contributed more than half the paintings at this auction, especially as an individual. So that was useful to know that, you know, sometimes people have a lot of talents which you don't know unless you unearth them. And this girl really benefited from having done that. So the team bought some of these paintings, which we have in our clinic. And it's also nice because every now and then we can point it out and tell other parents and patients that, you know, there is a patient who has done these things. So maybe you should try to see whether your child has other interests. And I feel it's nice that we have that. So this is Dr. Sunny. She approached me sometime earlier this year at a conference, She's a neurologist from Universitas Air Langgar, and she said that she was interested in working with me on something related to vitamin D. So basically, we wrote up a review paper with her team, and we've submitted that. So we're just looking at reviews on that. But sometimes, you do find interesting connections along the way, and it's nice to work with people outside as well. Okay, so this study is called MARS. It's the Malaysian Autism Research Study. And these are my co-investigators. Dr. Shafiq, Dr. Vivian, Dr. Fawaz, and Dr. Marret. And we looked at contributing factors to emotional dysregulation, as well as challenging and repetitive behaviors in autistic children. And we also looked at anxiety in the siblings, because this is something which sometimes siblings can be forgotten. And I feel very strongly that we mustn't neglect siblings, because they actually are the unsung heroes. They do a lot of things for their siblings, which we don't notice. So we looked at emotional dysregulation and challenging behavior, and whether these were associated with each other, and also whether severity of autism had a bearing on these factors, as well as anxiety in the siblings. And we included for quite a long period of time, because we had to do many convenience sampling. It was difficult we initially wanted to do universal sampling, but that became practically difficult. So we had to extend the study. And we found that using all these standardized checklists, we also needed to look at something for anxiety in siblings. So we used the SCAD, or the Screen for Child Anxiety Related Disorders, in neurotypical siblings. And it was important that we looked at neurotypical siblings, because we didn't want confounding factors as well. So I won't go into all these results, but these are some of the tabular results that we found. The main things that we found were that there were no significant differences between genders. So girls and boys had similar features, also in terms of age as well. And we also found that the activity as well as dysphoria were reasonably high. So the children who were more severely autistic seemed to have more dysphoria, that means mood symptoms, which makes sense. And also we found that for each of the emotional dysregulation inventory indices, the challenging behavior subscales were related as well. So again, it's a chicken and egg sort of thing. We cannot talk about causation, but we're just talking about associations here. But it does mean that those with autism severity had higher scores in terms of the irritability, in terms of the challenging behavior. And of course, intuitively that makes sense, but it means that now we have some findings and some data to tell us that we really do need to look for these features, rather than just focusing on managing behavior. We need to see whether the behavior is a symptom of something else, and whether we can manage the mood, and by managing the mood, does it impact behavior as well. But interestingly, we found that autism severity and other features didn't really correlate with anxiety in siblings. And the measured anxiety levels in siblings were actually lower than we expected. So again, could it be that it was underreported? At the same time, for parents who have a child who has neurodivergent and a child who's neurotypical, it's possible they may not notice the anxiety in the neurotypical child, because the neurodivergent child may demand more attention. So again, we need to maybe do a further study in the sibling group in greater detail. And for the older siblings, it'd be good to have self-reports as well. Okay, so I'd like to acknowledge Dr. Carla Mazevsky and her REACT team in Pittsburgh, because when I wrote to them to ask whether we could use this questionnaire, they were very supportive, and they gave me all the data related to this and how to use it, because it's not being used in this region, but they've been really very good about that. Okay, so this is the poster that was presented at the International Society for Autism Research meeting in 2024. Okay, so this is another study. It's mindful self-care and parenting style. And the reason I wanted to do this is because we've noticed that a lot of times parents' behavior affects or impacts children's behavior. And, we spend a lot of time counseling families when it's important for them to also have their own resources and resilience and be able to manage some of their challenges without waiting and coming to counseling all the time. Because technically we're not counselors. We just end up having to double up as lots of different things. So these are my co-investigators. I think you've seen them before. And I'd like to acknowledge Dr. Cook Cotton, who allowed us to use this scale as well. So a lot of times we have to reach out to borrow things or to get the permission to use other scales, but we're also working on several of our own listeners so that we don't have to always have to use other people's things. So the objectives here were to ascertain the level of mindful self-care in parents and compare that level between various developmental conditions. So, like for example, children with autism spectrum disorder and those with learning disorder, do you find that parental self-care is different? So again, you can argue it's a bit of a stretch because we don't have large numbers, but we know that there may be some trends that we might notice, which then of course would warrant further investigations and further studies. But the main thing was that clinically, we would like to know which group requires more support, at least in our clinic population, so that maybe we can devote a little bit more time for those parents if any trends emerge. And also to see whether there was an association between the parenting style and self-care. So with parenting style, there's main styles like authoritarian parenting, authoritative and permissive, and whether that sort of parenting style affected their self-care as well as whether they're potentially modifiable factors. And that's why it's very important, because we feel that you need to have a supportive environment for children as well as families. And just focusing on one or the other doesn't give you the complete picture. So we need to have a balanced approach, and we need to balance time with how much counseling we do, with both as well. So watch this space, because we have to analyze this, so there are no results at this point. But we basically gave feedback to parents immediately on their scores, because I felt that it's important to close that loop and give them the counseling straight away, rather than them not having anything out of it. So this way, we did manage to do our intervention even before we had outcomes, because this is just to inform clinical practice. Okay, so I won't go into all of this because of time, but this is just our study flow. So there's one last study I'd like to talk to you about. This is use of telehealth. So similar, overlaps a little bit, I think, with the first speaker. We looked at telehealth by parents of autistic children during the COVID-19 pandemic. These are my co-investigators. So Dr. Shafi, Dr. Chemliwa, and Dr. Jason, and they did this as part of Dr. Jason's master's project, and it was conducted in HSI Johor. So at that time, Dr. Chin was the consultant developmental pediatrician there. We looked at parental perception and utilization of telehealth in children with ASD, as well as the parental sense of competence, and also looked at developmental progress of these children post-telehealth intervention. So this was done by looking at the notes retrospectively, and because of that, it is a limitation, but nonetheless, it still gives us some information as to pre and post. So it was a quasi-experimental design, because we didn't really have a case and control group. We only had one group which we studied essentially like a cohort, but it wasn't longitudinally. In a way, it was retrospective. So it's quasi-experimental as well. And parents of children with newly diagnosed autism were selected. So only the parents who successfully completed the 6 months telehealth intervention for that period of time were recruited. And the children had to be between 2 to 6 years old, because we wanted a cleaner age demographic, so that in terms of parental sense of competence, it would make a difference, because with older children, you would expect some of that sense of competence to be from the child rather than the parent, and those kinds of dynamics would impact results as well. And we looked at socioeconomic circumstances, as well as the parental perception of telehealth and the sense of confidence. So initially, there were about 314 who were eligible, but 118 were excluded because they did not meet the inclusion criteria, and some declined. And then in the end, we ended up with 125, which is still a fairly good number. And we looked at parental perception as well as developmental scores. So this is just to give you a bit of idea of what the online intervention was. And it was done in 3 parts. So the first part was a 3-hour educational talk for parents, and it covered things like management of symptoms, diagnosis, etc., and school placement as well there. And we also, Dr. Chin did it. This is their intervention. They had a 3-hour seminar for parents as well, and mainly focused on children who are minimally verbal as well. And they also did part 3, which is what we call the PCCP workshop, or parent-mediated connect and communicate. So it's something like the DIR floor time model, which is used extensively for. And developmental progress pre and post were assessed using standardized tools. So this was not done in real time on study, but it was all done and documented in the notes. And what Dr. Jason did was he looked through the notes and gleaned the information from there. So the symbolic play test was used for the younger children, the complete scales were used, and even the Brigham's early childhood screens, depending on the age of the child. And so these are developmental assessments which assess different aspects of development as well as attention and play skills. And at the end, we found that more than 3/4 of the parents had increased knowledge about their child's condition. And this is all based on their report because when you talk about sense of competence or actual parental competence, it isn't really fair for us to assess parental competence as a third party because unless you have something standardized for that, it's still a judgment which can be subjective. Whereas the parental sense of confidence, of course, is subjective, but what we actually measured was what they felt. And at the end of the day, I think how they felt about the intervention was probably more important than how we thought they felt. And it improved their confidence as well. More than half had a reduction in anxiety. And we're seeing more and more anxious parents, more and more anxious children, more and more anxious siblings. So this is actually very important. They also felt better understood. And this is an aspect of care which we really need to emphasize because a lot of times people come with problems that they describe, but they're actually telling us something that's masking something else. So it's very important when you do development as well to look beyond that because what's troubling the family can also impact the child. And also a lot of times children will tell you things which they don't mention to their family because nobody asked. So we need to make sure that they're better understood and that being better understood really makes a big difference for everybody. We also found that many parents found the talk to me positive impact and significant impact on their child's progress. So this was their perception again, but it was also measured objectively because we wanted to see whether their developmental quotients improved as well. So of course, when we looked at overall sense of competence, parents were happy, but even happily with the developmental quotients of the children, there was an improvement which was significant. And the developmental quotient is essentially the child's developmental age as a ratio of their chronological age. So you want to see whether they're performing at what you consider their expected level for their age. Okay, so the main conclusions were that they were well received by parents, it increased their sense of competence, and there was significant developmental progress. And it's potentially useful as a telehealth intervention for training for parents. So telehealth consultations for assessments and diagnosis of children with developmental concerns have been done elsewhere and they can be done. But at this point, I feel strongly that sometimes a lot of it is the soft skills and a lot of the things are with interacting with the child, which are difficult to do online. So sometimes if you need to do a quick follow-up assessment, like you're checking medication and things like that, that's fine. But when you want to do an initial assessment, your rapport with the child, the family, if everybody feels comfortable, are they at their best, all those subtleties can be missed when you do it online. So I'd also like to acknowledge all the individuals who've always been very supportive of my training as well as starting up the center and throughout. And I think without so many people, we would not have been able to start the center. So this is Prof. Yazid, Prof. Marret, so moderator today, Dr. Rajini, Dr. Jayanath, Prof. Azana, so head of department, Prof. Yang, our current dean, Prof. Adiba was the dean at the time when I went for training, and Prof. Nazira was our clinical director until very recently. And also, thank you to staff nurse Haslinda, who's our clinic nurse, who makes sure that everything is orderly and neat and tidy and gets things done. And then this little girl, Yuan, and her mother, Jessie. So I got to know Yuan through Prof. Yazid because she actually paints beautifully and she wanted to donate some of the money from what she got from the painting proceeds to the unit. So Prof. Yazid asked what was it that she could donate within her budget. And then I thought, sensory mats is something that we don't have. And it's also something nice to put out because it ended up being a good thing because it's really popular with the kids who come to the clinic. And this is her and her mom donated sensory mats. And then after they donated some, I found that the kids would really liked it. So I bought some more and added them on. And I know it's actually something, it was really nice that she wanted to do that. Okay, so this is just thank you to the team. So this is the original team a few years back. And then now recently we had a new batch of medical officers. So Dr. Kavipriya, Dr. Rajvinder, and Dr. Kwei Zongdin. And it's always nice with medical officers because they're very enthusiastic. They bring a lot of energy to the unit. And I think it's always wonderful to see new people interested in development. And we actually rely on them a lot because there are times when they really step up and make a big difference in helping with the workload as well. So thank you, and I'll stop at that. Thanks.
Thank you, Prof. Subha, for that nice presentation, which gave us an overview of what we do at the developmental clinic, as well as to tell us about how it's actually played a role in capacity building, in training more developmental pediatricians, as well as understanding the challenges that our population faces with developmental disorders. We don't have any questions in the chat, but just ask you one question as the moderator. The study on the vitamin D deficiency, how does that level of prevalence of deficiency compare with the general Malaysian population of children, if we have figures? And do you think it's got anything to do with, sometimes the kind of rigidities and limited range of food intake that children with autism have sometimes, which may affect their nutrition?
Thanks for the question, Bob. So we don't have that much of local studies, but if you look at the study in school age population, it's actually similar. Like the thing is, we found that female gender was a risk factor, so that was something similar, but our prevalence is slightly higher. I think part of it is also whether they go outdoors. So as you mentioned, because of their rigidity, because of their food selectivity, those things can actually impact their vitamin D intake. So dietary vitamin D intake was reduced, but at the same time, that's not the main source of vitamin D that you would expect. I think it's mainly the fact that they are out of the sun, they don't sometimes participate in those things that affected it. But even neurotypical children seem to have reasonably low levels, which we wouldn't expect. So that's also cultural. I think sometimes when people go out, they're also covered. There's a lot of use sunscreen, wear a hat, don't expose yourself. And all of those things impact our results, which is very interesting because if you look at, say, like the temperate climate, in those areas, they have vitamin D deficiency mainly in people who are more pigmented and also during winter. So they do go on routine vitamin D supplementation at that time. But during summer, they don't usually have as much of an issue. Here we are, we're fortunate to always have sunlight, but it's always like that. You always take it for granted, but you always have. So I think we need to make sure that they go on.
The important message that all of us are at risk of being vitamin D deficient if we don't get enough sun exposure. Thank you, Prof. Subha, and also Dr. Rumana for the presentations today. And as the time is up, we're going to close our session for today. Thank you for all those who attended.
Thank you.